This demonstration is the blue Tidal enzyme peel applied immediately following a TCA peel. The indications for this are, first, that the blue Tidal enzyme peel will give an immediate increase in the comfort level and a cooling sensation to the patient who has had the TCA peel. Secondly, there is a significant lessening in the redness and peeling that will be encountered in the days following the peel by the patient. For benefits, blue Tidal enzyme peel will increase the firmness of the skin, lessen the photo damage of skin, and really enhance the skin brightening effects of the TCA peel. On average, we have experienced 40% shorter time span of peeling after TCA when blue Tidal enzyme peel is applied immediately after TCA. For the cleanse step, we can use the lavender creamy cleanser, the chamomile facial cleanser, or the salicylic face and body wash for step 1, which is the cleanse step prior to TCA. For the prep step, to degrease skin prior to TCA, you'll use our dual action toner pads. You'll start with one side of the pad, wipe down the entire face. You'll then turn over the pad to ensure that there is no debris, in this case, possibly any residue of makeup or sunscreen left on the face. And we can see that our cleanse step did very well because we have a totally clean skin surface. At this time, you'll wait a minute for the skin to dry before applying the TCA. For the peel step, this demonstration is using 35% TCA. This works very well with anywhere from 15% to 35% TCA. We recommend that you use the level of TCA that you're comfortable with and that's best indicated for that individual patient. We start with the patient's eyes closed always, and we like to always start at the forehead, coming down the side of the face. We're then going to our central cheeks. We want to sort of hug the chin line with our TCA and central cheeks. We're going to ask our patient to sort of close her mouth, pursing her lips, so that we're sure to apply the TCA on chin line and lip lines. We're always avoiding the crevices right next to the nose. And then we're going to use the residue left on the patient's nose. TCA is never applied to patients' eyelids. We now will wait, and it typically will take us several minutes until we start to see frosting. We see the frosting usually starting on the forehead as we're starting to see in this patient. It can be helpful to fan the patient's skin. Beth, how are you feeling? So the patient at this point is typically feeling a burning sensation, and we see that frosting has begun on the patient's forehead. So we see a nice white frosting from the TCA application. In any area where you see frosting, it's appropriate to put cool compresses. TCA is not neutralized. TCA, once the frosting has begun, it started the peel process. And so we're putting this nice cool compress on for patient comfort. And in just a moment, we'll be applying the blue Tidal enzyme peel. Again, the indications for the blue Tidal enzyme peel following the TCA are immediate indications of an increased comfort level. More long-term indications are shorter peel time, so that the patient has a nice resolution of their peel in less with less downtime. And then lastly, you will see increased benefits. So this is the Blue Tidal Enzyme Peel. We typically take into our bowl about 2 teaspoons, which is 10 cc's, which can be applied very generously to the face with a gloved hand, or sometimes I even like to just apply it. There's nothing caustic about this solution. It's all enzymes. It basically has a very nice combination of papaya and pineapple. And then we have a marine extract, which has very high concentrations of different minerals that are deeply hydrating and very immediately hydrating. We're going to ask the patient, how are you feeling now? Better, okay. Yeah, so we really get a real immediate improvement in the tolerance of the TCA, and we leave the Blue Tidal Enzyme Peel on the skin now for a timing of 5 minutes. How is it feeling now?
Fabulous. Positively heavenly.
It does. It really converts what is otherwise a relatively uncomfortable procedure, 35% TCA, into a much more pleasant experience that will have a much shorter downtime and increased benefits for the patient. Again, the increased benefits are, besides a shorter number of days of peeling, the other great benefits are an increase in firmness from the procedure, a really remarkable increase in skin brightening, and really overall a firmer sense to the skin after the TCA peel. So this is the TCA followed immediately by the Blue Tidal Enzyme Peel. Beth, compared to having just the TCA with little cool compresses, how are you feeling with the Blue Tidal on you?
Literally, it's night and day. This feels like it smells wonderful and it feels wonderful. I feel very relaxed.
No burning now?
Nope.
Yeah, so this really makes TCA not only more tolerable, but even more effective. So the last step with the Blue Tidal enzyme is that we're going to be washing it all off just with water. I think you can see that we had already had frosting. The Blue Tidal enzyme is calming the redness and the frosting. We're now going to do hydration with a little bit of our Cosmetical Vita C peptide spray. We are next going to be applying a little bit of Vita Soothe. Followed by sunscreen. We'll be using the Daily Replenishing SPF 30+. You can see that the sunscreen sits on the face a little bit differently after the TCA. So we'll just wipe off a little bit of excess and she will be very good to go. At home, her regimen will be to use the hydrating spray and Vita Soothe 2 to 3 times a day, and the Daily Replenishing SPF 30+ every morning with reapplication every 3 to 4 hours when she is outdoors. Typically, we do see the patient back in the post-op, the post-peel period, anywhere from 4 to 7 days afterwards. Thank you.